You ready, Joyce?
Okay.
Good morning, everyone. Once again, welcome to the Advisory Council. I hope everyone had a great day, and I hope everyone's enjoying this beautiful weather we have today, and I hope everyone's staying safe. Just to remind everyone, everyone should be on mute at this time, so therefore we can make sure we hear everyone. Joyce Levin is here. Joyce is
Good
here.
morning.
Here, the DD Council, Deborah Greif.
Yeah, good morning, everyone. I'm here.
So we're gonna, and if I mention every executive board, we'll be here until next year.
But my exec board members are here, and I welcome them all.
Yes. And now we're gonna move on to, first things before we do anything is, we're gonna have a few minutes of silence of any individuals or people who passed away during the
And their family
Corona-19
members for their family members.
So we ask everyone to please have a few minutes of silence. Thank
Hello?
you. Yes, Joyce, we just had a few minutes of silence.
Yeah, I couldn't hear anything. I'm sorry.
Okay.
We were being quiet.
Okay, now the minutes. Did everyone, and I'm going to remind everyone, the minutes are also available on our website as well as on the YouTube page. Did everyone get the minutes? And I see a lot of people chatting on, so I see a lot of information going on, so that's good.
Okay, I'm going to ask my exec board member. Sharon, can you make a motion to accept the minutes, please? Sharon, can you hear me?
Sharon, you're off mute.
Can you make a motion, please?
Hi, this is Laurie. I'll make a motion.
Okay, and Sharon, can you second it? Yeah, I heard you, and I heard Sharon.
I, Sharon, should second the motion.
Thank you.
Any necessary correction.
Thank you very much.
Thank you. So thank you.
I want to thank you, Laurie, and I want to thank you, Sharon Shields. Laurie Rosenfeld is my first vice chair on the advisory council, and Sharon Shields is the second chairperson, and also should be online is Sandy Naper, the secretary, the recording secretary, and on this council, Christopher is the
vice chair.
The Brooklyn Family Sorry, he's the corresponding secretary, and Menino is the executive assistant on the Brooklyn DD Council. Chris is the vice chair, and I am the secretary. And Joyce, we got everything ready. So are you ready, Joyce?
Yes, I'm just going to change there's going to be a slight change of the agenda. Joyce has to leave at an emergency, so I'm going to ask, and our speaker has agreed to speak at 11 o'clock, so we're going to move around the agenda. We're going to start, very important thing is Joyce, are you here?
Yes.
Okay, we're going to start with your report, and I will make sure we do the committee reports a little later so we can just keep moving.
Okay. Good morning, everybody, and thank you for joining us. I don't have a very long report today. A lot of changes have come through. We're expecting more changes to happen. That's the name of the game of what goes on now with, I hope everybody's safe from COVID, and please remain safe. Things have become very challenging. We have a number of areas that have become hot zones, red zones, yellow zones, and for those with agencies in those areas with programs, group homes, or day programs, we need to ensure people get tested, and that everybody again is safe, and following all the protocols. We've also come up with some changes, and I think Lucy and Odelia will talk about those in terms of reimbursement to agencies for vacant beds, as well as when the individuals in the group homes want to go visit with their families, there's been a decrease now in terms of the reimbursement that agencies will receive for those services. Basically, that's what's been going on, other than trying to make sure everybody is safe. And we, again, just need to ensure that that's happening. And I'm just looking at my notes right now. Basically, that's it for now. I know that's really short and brief. And I apologize for that, but that's all I have for now, Chris.
Not so fast, Joyce. You do have one thing on the PowerPoint that you asked. We agreed. I'm going to move on to.
You did send us information, remember?
Yes, the Wi-Fi information.
Oh, yes. And again, I apologize because I don't have internet right now. So we got this through Chalkbeat, but there is free Wi-Fi internet being offered. I'm sorry, Chris, do you have the information?
Yes,
we do.
it's on the screen, and it's kind of funny because the same time you send it to us, Moped sent this to us as well, but actually it's actually still continuing. This is the information we have here. They are still offering free public Wi-Fi for up to 60 days to a family who do not have already
subscription already.
Mm-hmm.
And there are the numbers that you can call. For English, it's 1-855-846-8376 for English enrollment. For Spanish, it's 1-855-765-6955 for Spanish enrollment. They also are doing Comcast free public Wi-Fi. That's for households. It's for Spectrum who don't already have Wi-Fi. Also, the Charter Communication free Wi-Fi access at Altice USA. We do have this listed on their website. If families need or agencies need it and they're having trouble, they can call us after the meeting, and we will give you the numbers again.
And this information is also available on our website. If you go on to How to Keep Yourself Busy page, and this information is still there. So this Wi-Fi is available, but we also do want to remind everyone, it is always contact 311 as well.
And if you have trouble getting on, and if you have trouble, you can contact also 311, but also let Moped know too. Let them both know, so that, because they're the ones who are sending out this information, and this is from the city. This is not from I don't want to think this is not from OPWDD. This is from the Mayor's Office of People with Disabilities and also New York City. So if you need other information, please let us know afterwards. Thank you.
And I think, Joyce, Debbie and you both agree with me on this other panel. And I'm going to move up to here. It's important, everyone, to please go vote. Doesn't matter who you're going to go vote for. We don't really, that's your business. But this is the early voting procedures here. Joyce, you hearing me? I just make sure you heard me. Joyce?
I'm sorry, what, Chris? I couldn't hear you.
We're
Okay,
talking about the Board of
Elections.
Okay, I'll do it, Joyce. We have up now on the page for who people can see. You can do early voting period is from October 24th, 2020 to November 1st, 2020. Weekdays, it's going to be Monday and Friday, 7 a.m. to 3 p.m. Tuesday and Wednesday, it's 12 p.m. to 8 p.m. Thursday is 10 a.m. to 6 p.m. Weekends is 10 a.m. to 4 p.m. You can also, if you received an absentee ballot, you are allowed to drop it off at that site, any of those sites, or even have a family member or someone bring it to your regular polling place on the actual day of the election, which will be on Tuesday, November 3rd. is very important. Everybody votes. We have to vote for not just only the president. We're voting for our Congress and there's, I don't think we have any other special elections. But you know what? Each area has their own may have a special election, but please vote. Individuals who are 18 and above, as long as you've been born in the United States or naturalized citizen, are allowed to vote. And also, if you know the person has trouble with writing, they are or have other disabilities, whether visual, physical, are legally allowed to use what's called the ballot marking device, which is like a big gigantic pencil that helps you vote. And you don't also have to have a disability to use the ballot marking device. It is, if you are turned down, you get to go to the coordinator and make a complaint, and then afterwards contact 311 to say that they tried to dissuade you from voting using the ballot marking device. It's for anyone who wants to. Okay, thank you.
Now, let me just move, and just to remind everyone, the next meeting for the joint meeting, and Joyce will agree with us, it's Monday, November 18th. Topic will be to be announced again, and this will be on the same system. Always remember, everyone, when you go on, it's always meeting, it's ringcentral.com/joint, and then get the meeting ID number. That's the easiest way, or just use the phone. Those are your two choices. Again, the next meeting, joint meeting, is November 18th. Does anyone have any questions for Joyce or Debbie? Well, Debbie will be doing some of her report in a little bit, but just does anyone have any questions for Joyce? And I'm gonna just double check, because sometimes.
Okay, I don't see anybody. I'm gonna go on with my report. I don't have a lot also to really report, as basically we all basically have been staying home. But I will let everyone know that the chairperson of the New York State Family Support Service Advisory Council is Margaret Whittington, who just informed us that we will be having our quarterly meeting on Wednesday, November 4th, from 2 to 4 p.m. I have not received information from Josie upstate when, if public will be allowed. But one thing we are going to be learning about, an introduction to Nicholas Hobson and Alex Harrington, his supervisor, update on reopening of OPWDD services, and how OPWDD is handling hotspots, budget updates, including the 20% withholds on state-funded services. So that is all the information I have. If you're and also when families are having trouble and need to talk to someone who understands the system, you can have them call us or email me, and we will speak with them and try to help hold their hand. Yes, it's very difficult right now because we do have certain hotspots in our areas of Brooklyn, but we will work together to see, and I know OPWD is doing their best to try to keep our services intact and to follow the rules of the governor, Cuomo, who decides which places are open or closed. If anyone has questions, I will try to answer them. If not, we will move on.
Okay, one thing that Debbie's forgotten also.
No, I didn't.
Well, you're the chair.
Okay, I would also like everyone to know that I'm not going into it deeply because our last speaker will also, but we're trying to help stop the COVID-19 spread. Now, as you know, I'm the chair for Brooklyn. Tina Vale is chair for the Bronx. And Aliyah Hussein is Queens. We are going to host next Monday a town hall on Monday, October 26, 2020, from 10:30 a.m. to 12:30 p.m. and at night, 6 p.m. to 8 p.m. And you can join from the PC, a Mac, a Linux, iOS, or Android. And what is our discussion? How we can help and protect our families against getting the COVID virus, and also why it's important for us to wear masks. And in case our individuals need specialized masks, we will have the information available, which means some people need to wear a clear mask because they're hearing or need to see the facial movement so they understand through body language. We will also get that information to them. So I want you to know the 3 councils, we have put out an invite to Staten Island and Manhattan. They said they'll get back to me, so I'll probably hear from them within a day or so. But at the moment is we 3 are going to do it together. So with that, and we are working with the New York City Mayor's Community Affairs Unit, and we're working with Miss Maria Mark. I know Miss Mark also from another. I am on my local community board, and Miss Mark is my community liaison to the Mayor's Community Affairs Unit. So, but we'll talk more about this later.
Okay, thank you. And
Thank
does
you.
anyone have any questions for Debbie? If not, you can always catch her later on when we do our other reports. We're going to move back on to Winnie from IEC. Are you here? Because I know I just heard you
Yes, hi, can you hear me?
loud and clear.
Great. Good morning, everybody. So I'll make it a brief report. I know that you heard Joyce and Deborah talk both about the October 1st residential cuts and also the 20% withhold. The federal funding for our state is absolutely seriously important if we're going to avoid making that 20% withhold permanent. And on Friday, I would have told you that there was no hope for a 4th COVID package in federal funding for our state. But today, I'm telling you something different, which is better than Friday's news. And that is that Nancy Pelosi offered 48 hours to make a deal with the president's team, and we'll see what happens. So fingers crossed there's state and local funding in that package and that it actually happens. It's so volatile in Washington, D.C. Getting back to everybody has to vote. Let's see, there's an Evb Tech Seminar tomorrow at 2 p.m. And if you're interested in that, you can put a note in the chat and I will send the link to Chris for him to send out to everybody.
Mm-hmm.
There's also a federal advocacy on retainer funding. Retainer funding was money that our day programs were getting when they had to close down. And even so, we've opened a little bit, but with the hotspots and everything else, it's been very nerve-wracking for families and people to want to come back to day programs and risk becoming infected. So if we could get the feds to lighten up on that retainer funding, we had 3 30-day periods of retainer funding and then they stopped it. And so there's a House sign-on letter, and we'll be doing some advocacy to try to get some signatures on that House letter shortly. As far as COVID goes, 3 more states have been added to the travel advisory list. There's 38 states on there now. The new ones are Ohio, Michigan, and Virginia. And as Deborah mentioned, we've got the hotspot situation going on, red, orange, and yellow. The state is viewing the hotspot developments as the second wave. That's what it's going to look like. And the governor has put into place testing and action strategy. It's new, based on those clusters that you've heard about the red, orange, and yellow, a cluster action initiative, which is newer. It's for Brooklyn and Queens, Orange, Rockland, and Broome counties right now, but wherever a micro cluster will break out, they have information based on our ability to test that is to the address. So they're going to look block by block in all of those red and orange areas at cases and tracking them. We're doing better. The hotspot infection rate was higher than it is now. And we will continue to monitor that and to place additional restrictions on those areas where the infection rate is high. There is a draft vaccination administration program that the governor just put out, and this is going to prioritize at-risk people and essential workers, and it appears from the language that maybe our workers and people who live in our residences will be in the first wave of priority, so that's a good thing. What else do I want to tell you? So there's a few initiatives out. regarding the cuts. We've got letters that I will send to Christopher so that he can send out to everybody. It's a one-click letter, really, really simple. You don't have to write anything, to send to both your federal representatives and the governor and your state senator and assembly member, protesting all of what's going on, the 20% withhold and the 10-1 cuts to residential services. So families are also, I'm sure that there are some people on the call right now who are involved in some of the family initiatives. They've been super active and really getting some good traction. There's a petition, and I can send all these links to you, Chris. There's an e-card for Save Our Services. There's a couple things in the works being planned, maybe a rally outside the governor's office in Manhattan. And there's also going to be like a picture social media campaign, which is pretty exciting and fun, that started already in Western New York, and on Long Island there's plans to do it, and will involve the entire state, of course. OPWDD, I'm sure they're going to talk about this, but they're working on a technical amendment to the 1915C waiver, and they're looking at what modifications have been really helpful in day programs and what, maybe hasn't been as important to keep. So day providers have been asked to fill out a survey. It's really important that you do that. In addition, the associations are putting out their own suggestions for modifications that should stay through the end of the pandemic, and then others that we feel should be considered to be kept forever, like teleservices and some other things. And I'll stop there.
Winnie, Deborah Gretsch, the advisory, has a question.
Okay, great.
Okay, Winnie. Now, you know how I do, my own major concern first is this. I understand to do a rally, but because of social distancing, I'm a little worried about that, because you always get certain rabble rousers in the middle recently that may cause us problems. How can we do that safely? I mean, please, I don't want you to think I'm emailing, texting. I'm going through every social media that I'm attached to, send it to the governor's page. But I'm concerned only about, when I say in person, is because there are limitations in New York City because of the certain hotspots. So how can we do that safely?
Great question, and I should have mentioned, yes, that is on our minds too. And what the plan is, and again, this is a family initiative, so I won't take credit for it, but they're planning to have a rope, knots every 6 feet to keep us 6 feet away from each other. And of course, mask wearing is mandatory, and it's outside, so it's a little bit safer, but the rope with the 6-foot knots, that's the plan, and I think it's a really good one.
Okay, but I will also say, I want to say this to everyone. If you are not comfortable doing that kind of protest because of the possible COVID-19, you can still contact the mayor, the governor, but you can also do the mayor too if it interferes too with certain backing up of anything that could affect us. You can do an email, phone call, and our governor, as well as the mayor, and all elected officials are on every form of social media. So that is just as important, because sometimes we can't right now due to the COVID-19, and we have to be careful. I understand the other family initiatives, but I am concerned because of that.
We have someone raising their hand. Maria Mark, you have your hand up. What's going on?
I just wanted to know, what is the location of this rally?
So it's still in the planning. This is just sort of a heads up that it's coming. And it would be 633 3rd Avenue, which is the Manhattan Governor's Office.
Okay.
We've done many rallies in that location, and we've already checked with the community affairs and the police precinct, and they're fine with it as long as we maintain our social distancing. And what Deborah said is absolutely correct. There's so many ways to advocate. If you feel like that would be an unsafe move, don't go in person. There's a million other things you can do. We've got the petition, we've got the letters. I mean, do them all, as many as you can. Thank you.
Thank you.
Does anyone else have a question? I also want to thank Maria Mark for one thing, raising your hand.
Thank you, Maria. But Winnie, you know it's very important to the families. The advisory councils, we do advise, but I know statewide, we are worried about,
NDD.
and the DD council, we work in New York City, we're working as a partner, and we understand the issues that are happening with the local, with our services. But my families are worried because, you know, they want to know what's our service is going to be things that heard. Families have emailed me, and I won't say their names because they're afraid. Will OPWDD be forced to close? That's a big fear. And I'm kind of concerned too because our services are so valuable and important for us, and I don't want this to ever happen, but I think so. And if Joyce, you have anything you want to add in, please?
Joyce?
Sorry. Yes, I was on that call with Winnie and some of the other boroughs, and there are some family groups who are very interested in doing that rally, again, understanding the social distancing, and that many people won't be able to participate in it, but they thought it was an important way to show the governor and elected officials that the voices are still there, they're not going away, and in fact, they're increasing, and the services are very much needed. So, and Winnie will certainly pass along the information about that. And certainly, again, doing the cards, the calling, the social media is another great way to get that information out. But there's a lot of people or a lot of different agencies throughout the state vying for the same dollars. But we have to make sure our voices get heard. And as you know, we've was on the car rally that, you know, Governor Cuomo, don't send us back to Willowbrook. So we have to make sure that that never, ever happens again. Okay. Thank you.
Thanks, Joyce.
Yeah.
Thank you, Joyce. Does anyone else have any questions for Winnie? Because if not, then I'm gonna ask Lucy and Delia. You guys do you want to do your report?
We first should thank Winnie for.
But also I want to thank Winnie.
Winnie, both Joyce and I want to thank you so much for the update and report. And yes, I know my advisory council members will be advocating,
As well as the DD.
and the DD council will be doing it as a team.
My pleasure, guys. And I'll send those links to you guys to send out to everybody.
Thank
Thank
you
you
so
all
much.
So good morning again, everyone. This is Lucy Omezi from OPWDD. Unfortunately, Delia had to leave. There was an emergency that came up, and she had to leave. So I, apologize on her behalf.
No, it's okay.
We accept it. We understand. You're right now, OPW.
No problem.
Yeah.
Yeah,
Thank
we're fine.
All right, great. Yeah. So, as was already said, the 1915 Comprehensive Home and Community-Based HCBS waiver was approved. The October 1st, 2020 waiver amendment was approved by CMS. And we understand that there was some kind of misunderstanding or confusion and misrepresentation about the rate setting provisions that was made in it. I'm just gonna go over that briefly. That previously, when providers had vacancies in their residences, they received a portion of funding for that vacancy, no matter how long it went unfilled. So now what's happening is that, providers will no longer receive that reimbursement for vacancies. However, they can make up that vacancy by filling it, and working with our regional offices to offer people residential placements more quickly. We know that we've talked about it, that, a lot of people, need residential placements, and we're always, that's a service that, it takes a while for it to happen, and there's always, a hassle going on. So hopefully with this with this amendment, we're hoping that, people will be placed more quickly. We also believe that, as a result of this change, that people will have quicker access to the residential opportunities that they need. In addition, a reduction was also made to the reimbursement for the retainer days. And those are the days when people are out of the residence and they're receiving another Medicaid-funded inpatient service, such as if they're in a hospital or they're in a nursing home or they're somewhere else. In the past, OPWDD was kind of, paying 100% of the rates up to 14 days, while Medicaid paid the inpatient expenses as well. So under the new budget, providers will receive 50% of the reimbursement for up to 14 days, recognizing that they may have some expenses related to the person being out of the residence. So that was the change that was made. In the past, OPWDD or the state continued to pay, and Medicaid was also paying the providers. But now that would no longer happen. OPWDD would just pay up to 50% of the reimbursement. In addition, there are also changes concerning the therapeutic leave days. Currently, when people are on vacation or at home with their family members, providers are paid 100% of the rate with no limit on the number of these vacant days. So since services are now being delivered in the homes while the person is away, the new rates, we only pay provider 50% of the IRA rate with a cap of 96 days per year. So if someone is out of the residence for more than 96 days in a year, then the provider will not get paid for those extra days. But if it's within 96 days, they will continue to receive payments. So those were the changes that were made. In addition, the waiver, the new agreement also has changes that was made to the documentation of choices form. This is part of the forms that is required to be signed by the family members if they're enrolling in waiver. So there's not a need for signature. We're no longer requiring signature from the care manager. In the past, we require the care manager to have a signature, and then the regional office will need to have a signature, family members sign. And since COVID, we're accepting verbal consent for family members. So at this point, if family members are not signing, as long as the care manager can document that they receive verbal consent, we're moving forward. But with a change, the care managers too don't need to sign. And also, OPWDD has been talking about the need to kind of standardize and make, the authorization for ComHab to be consistent. So this is something that is also going to be happening. That change is going to be happening probably by January of 2021. So it was included in the amendment. So we're going to be moving forward with that. So the way that we authorize ComHab, so that it's more consistent and standardized. These are the updates that I have for OPWDD. Any questions?
Joyce, you want to go first?
I don't have any questions. I mean, I guess just a comment in terms of the limitations on the visits for the individuals that live in group homes with 96 days. That certainly, some people, will be a big change. And agencies are grappling with how to deal with that, because you don't want to tell a family, no, you can't have somebody, your loved one, with you for more than that amount of time on the one hand. On the other hand, it's devastating to the agencies. And I don't think anybody realizes how devastating these changes are going to be. we'll see over the next couple of months, that combined with COVID, and the other vacancy when an individual's in the hospital or nursing home, sometimes people are sick, people are out for 2-3 months, but things remain the same. I mean, the staffing doesn't change, the lights have to be kept on, people still have to eat, and I don't think any of that's been taken into consideration. And again, there's different opinions and views on that, but the reality is those things still need to get paid. So that's all I have to say about that for now. Chris?
Yes, I'm here. I'm just unmuting, making sure we can hear you.
I have a question. Do you want to say anything first to Joyce?
Lucy?
No?
Lucy?
Are you there?
Hi, this is Delia. I'm sorry, I had
you came
to
back,
step away
Delia.
for I'm so sorry, I had to step away for an emergency call.
Sure.
Joyce, I do hear your feedback. I think it's something that we've heard from other providers as well. It's certainly feedback that we can take back. But I think, we will hear from other families and see how, this impacts them as time goes by, and see how it goes.
Okay, Delia and Lucy, this is Debbie. This is my question/concern. Our individuals are prone to poor health. Many of them are aging before that we never saw before. My first concern is COVID-19 can affect a person with pre-existing conditions, and that means they could be stuck in a hospital for far longer than the 96 days. And the other thing I'm going to say is I know a lot of the individuals, and because I'm with their families, a lot of them have had to have surgeries for knee replacement, hip replacement, anything. Now, especially for COVID, though, what are you taking in account? Because when you get COVID, you can't get, not that easy to always get over it because there's no cure right now. So how is this going to be? Because what I'm concerned about is I don't want the agencies to go under, and I'm concerned about the individuals who live in group homes who also don't have families and will be affected by any cuts that could happen.
So I think there's a bit of confusion about the therapeutic date. The therapeutic days are when someone goes home with their families. And then the retainer days are those when a person is receiving another Medicaid-funded service, such as like a hospital or a nursing home, or a rehab of some sort. So those are the different services that people are getting. So I think the 96 days is the cap for therapeutic days, and then the retainer days are separate. So that's not the same for when somebody's in the hospital.
So so an agency would not be penalized if, say, the individual has to have knee replacement and has to do rehab, but they don't want them to do it at their group home. They want to make sure they do it in a nursing home, but the rehabilitation portion of the nursing home. Is that going to be taken into account?
So when somebody is receiving services at another inpatient, Medicaid-funded inpatient service, such as a hospital, the provider will be paid for 50% of the reimbursement for up to 14 days. So they're receiving another Medicaid-funded service outside of the residence. Traditionally, providers were being paid at 100% of the rate. Now they're going to be paid at 50% of the rate.
Is also OPWDD trying to see that, since a lot of these individuals who are of older age and they collect now Social Security under their parents because they're DACs, Or is OPWDD trying to collect under their Medicare Part 2 to help the agency?
I'm sorry, I didn't understand that. Can you say that again?
Okay. Individuals whose parents have either become disabled, retired, or passed away, the individual starts collecting under their parents' Social Security. Within 24 months, they get Medicare also. So they have Medicare, Medicaid, and a lot of rehab, and there are a lot of services that Medicare pays for. Has OPWDD worked out something to also collect from Medicare so the agency won't lose so much money, because they also, that's another funding pot that needs to be tapped into.
No, I haven't seen that in the plan at all.
Okay, unfortunately, we need to bring that, I have brought that up to our commissioners for many years, because that is a funding service that would help agencies, especially as our individuals, many of them are in poor health due to lack of appropriate medical care. I'm not talking about like the Article 16 or 28 clinics that are under OPWD auspices. I'm talking about the others who ignore our population and treat them horribly. That's my concern. Because I'm trying to figure out ways, and I've brought this up so that you can tap. In fact, Jim Moran, when he was budget director, he even said I was correct, that we should have been collecting, tapping into the Medicare funding for it.
Dilly, you want to?
I know that the commissioner has been, going to different forums and meeting with families and other stakeholders. So it sounds like you've already voiced your concern and brought your feedback to him on that point.
Yes, I have, and I'm going to let others question, but I'm still advocating so that more funding can come into our population as a team. But it's a big help. Would be a big help.
Okay, Dilly, we have another person raising their hand. Can that person? I'm going to unmute you, or can you unmute yourself? It's RKI.
Yeah, it's me. It's Rochelle Kivanowski. Thank you, Chris.
No problem. I'm just removing your
You can
hand.
hear me, right?
Loud and clear.
Yes, we can.
First, I have a question and then a comment. So my question is this. For the therapeutic leave days, my son resides in a residence. So if I pick him up, let's say on Saturday after lunch, and I bring him back Sunday after dinner, the residence is still providing service to him in the Saturday morning, and then again Sunday evening. He gets his medications. There's goals to be met. With this new amendment, does that mean that overnight visit is then still only paid at 50% because his head is not in the bed? So that's my question.
I believe we were going to be getting clarity on exactly that situation. So, if a provider is able to provide a service before the person leaves for the day, before an individual leaves for the day, do they get credit for that service? Do they have to count it as a therapeutic leave? So we're supposed to be getting a feedback on that. I imagine by this week we should be able to get an answer on that and get back to you to see how providers are able to bill for that. Because I think that's a question that many providers have at this point.
Well, and as a parent, I also have that question because my feeling is, especially during the pandemic, in general, but especially during the pandemic, with day programs not available to most residences, people who live in residences, they need their family support more than ever. I know for my son, not being able to see us all those months caused severe regression for him emotionally and behaviorally. And it's still an issue, and we're trying actually to be circumspect, on behalf of the agency, because if they lose funding, services will undoubtedly be degraded, no matter what their intentions are. And so we try not to take them out too much, but this is cruel. There's no other word for it. And it's essentially, it's kind of treating these residences like a flop house. So, you know, you get paid by the day. It's not treating a residence as somebody's home. And it is in contradiction to the very essence of community integration that's mandated by the whole HCBS waiver. So I just wanted to express my consternation about these cuts and the way they're treating individuals who live in residences, and how they're treating the providers who are trying very hard to meet their needs, and how this is driving an objective tension and creating a rift between providers and families, which is totally unacceptable. Thank you.
And this is Chris, and I can understand the frustration as well, because she's not the only parent, Delia.
Oh boy, I think they know that.
Delia, as Lucy's been on this meeting, and I'm sorry to interrupt, but with these, we've been getting a lot of families, the last 2 weeks are concerned, and they're not just coming from us, we're getting a lot of concerns. So we definitely need to work together on this issue, you know, and try to keep, and as a reminder to every parent in here, as well as our fellow individuals who are advocating, we need to work together. And I know our elected official representatives are hearing this and also with us today. We need the funding, please.
Thank you, Chris. And I just wanted to thank the parent that gave the input. You know, I think that these rate actions were, you know, put in place as an alternative to across the board cuts. So that was the intention with these rate actions that were put in place. But I can understand that the impact is affecting a lot of families. So thank you for the input.
You're very welcome, Delia.
And Delia, Joyce, you want to add anything? It takes her a
No,
second.
Chris. I think Ms. Kivanowski said it. She said it better than I ever could.
Yeah. Yes, because we parents, we're the ones living with this. We love our children, but you know, we also know there comes a time some of that children will have to be placed residentially, but we want to still keep in touch and be with them. So it's like if our child without a disability who went to live on their own, and then we like to see each other and keep in contact too.
Now, I'm just going to ask anyone else has any questions.
We have Lucy and Delia, and they're
here.
They're ready to answer questions. So if you have, please let us know.
Let me know now. If not, Delia, if anyone has any questions, I will make sure to email it to Lucy. And Lucy, you're there?
I think Lucy might have gotten disconnected. She was going to try to sign back on.
Okay. Oh.
But I can share my email address if that's okay. I'm not signed on by the computer, but
I know you're on the phone. Let me get a piece. Wait a minute. Somebody just.
Delia, I have your email. I will share it.
Okay, if you want to put it in the minutes, yeah, that's fine.
I will. But I'll do it right before the meeting ends. Okay.
Great. Thank you.
You're welcome.
And we'll make sure that everyone, if you have any questions for Delia, please, we will send you the email for her.
We'll forward everything to you so that you won't hear it.
And Delia, you're always, and I think Joyce will agree with me as well as Debbie, you're always welcome to come to the meeting. We do make sure everyone hears you and make sure that we all work together in Brooklyn.
I would love to be back and share, you know, more input as I can. I think this is a really tough time for a lot of people. I think, you know, especially just as a community, you know, we're dealing with not just, you know, the economy, but this global, you know, pandemic. And I think we're all really trying to manage the situation as best as possible and really keep everybody safe. So I think it's really important that we communicate, you know, as best as we possibly can.
Yes,
so I would love to come back, and you know, if you could share the invite with me to my email address, that would be helpful.
That's not a problem, and it's duly noted.
Delia, we really appreciate you coming on and again sharing the information and taking the questions and letting us know what's going on, and we appreciate it.
Oh, yes, and
Sure.
Delia,
I can stay on for another 5 minutes if anyone
if
has any
anyone
more
else have
questions.
questions for Delia, please,
Okay.
please ask her. Please, if you really have a concern or question, you have the right to ask her. She needs to hear the communication, so because her role is to make sure we are receiving the services, and if there's something wrong or an issue, she needs to hear it. So please let her know. Well, watch, I bet they will want to put it in writing, Delia.
I think they're going to put it in writing.
Okay.
Okay. Since no one else, Delia, we do have a speaker. I think maybe you want to be interested to hear about a little bit of coronavirus. We have this other young lady, same age as you, age 23.
Thanks, Chris.
Hey,
I'll take it.
and that's Maria. Good, I'm just going to say.
That's Maria Mark.
And there she is.
Hi, Maria.
Hello, how are you? I'm very good. I hope everybody's doing well.
We're trying, Delia.
And Maria. And Maria, I'm setting up your PowerPoint, which I have. So we're going to switch it to Maria. Now, as everyone will realize, today's topic was, and I have to say, budget and the coronavirus 19. So our speaker today is Maria Mark. You met her definitely seen her as she goes around. She's the Mayor's Office of Community Affairs, and she's going to give you guys some information. And I do want to thank Maria, as Deborah and Joyce part of Debbie and Joyce report. Yes, we are doing a town hall next Monday to make sure that all our disability families are making sure. But Maria will mention again in a few seconds. So Maria, you're on.
All right. So first and foremost, the update that I have is current as of today. The update that is going to happen next week, and they're going to go a lot more into this. It's either going to be someone from the Test and Trace team, the Department of Health, or both, because we use both of those teams for these presentations. They're incredibly knowledgeable about the issues that we have to deal with. So right now I just want to do something a little bit more brief because everything may change. So the governor had, not this last Thursday, but the Thursday before, had put out maps about cluster zones, and people were put in one of 4 zones. They were either red, orange, yellow, or no zone at all. And there were guidelines that came with that. Now, what I can tell you, which is likely not going to change, is what the restrictions are on all those different zones. But what may change, because from what the governor had announced, he said that they would, those areas, a particular address would be in that zone for 14 days, which is going to be this coming Thursday is going to be the 14th day. And then they're going to reevaluate. That means that it could be that the maps are going to stay the same. They're going to just keep it for another week or two, or however long. It could mean that they are going to expand the red zones, orange zones, and yellow zones, or it could mean the opposite. If they're seeing lower numbers and things are getting significantly better, then it could mean that those red zones are going to get smaller, those orange zones are going to get smaller, and those yellow zones are going to get smaller. And so the goal is, of course, for everybody to be very safe. And the way that we're looking at what those numbers are, the way that the governor is looking at what those numbers are from tests. So you want to 100%, if you haven't gotten tested already, please get tested. I know that I'm not the first person today to have mentioned this. I caught part of another presentation where that was a big thing. It's very simple to find a testing site. You just go to nyc.gov/COVID test. It's easy to remember because it's they try to make a lot of these URLs very simple. So for those on the phone, you're not missing out by some kind of really long and exaggerated website where it's like, and then /this/that, but it's nyc.gov/COVID test. That's the easiest way. And so obviously we want to make sure that people are not getting sick. There are the very basic things that we've been talking about since March. Stay home if you're sick. Stay 6 feet away from each other at minimum. Wear a mask and wash your hands for at least 20 seconds. And when you can't wash your hands, use hand sanitizer. So those are the guidance that we've been talking about for months and months and months. That hasn't really changed. What's changed is the restrictions. So right now, there are a number of neighborhoods in Brooklyn and Queens, and at this point, it's only in Brooklyn and Queens that are in these zones. And what that means is that we've been seeing significant spikes in testing and people getting sick in those areas. So I'll just very briefly put the easiest way of explaining what those zones are. The red zones, which is the highest testing, that means that schools are closed. That means that small non-essential businesses, all non-essential businesses are closed. It means that restaurants can only do takeout and delivery. It means that houses of worship can only do 25% capacity, but it cannot be more than 10 people, so whichever one is less. And it means no non-essential gatherings. So if the governor turns around and says that there are going to be more areas in red zones this Thursday, or starting this Thursday, then that's going to affect other areas. And so that's what those red zones are. Orange zones are a little buffer zone in between. And so that's where they want to make sure that we contain the spread. And so these orange zones are a little bit more, they allow for a little bit more from everybody, but they're still there to make sure that everybody's protected. So schools are still closed. Businesses are open. The only thing is that things like gyms and personal care services, so salons, nail salons and hair salons and all of those kind of things, those are closed. But other businesses such as clothing stores can operate in those orange zones. The restaurants are allowed to have outdoor dining in those zones, but there is a 4-person maximum per table. They cannot do indoor dining in the orange zones. And for houses of worship, that's 33% capacity up to 25 people. So those are kind of that. When it comes to non-essential gatherings, you can actually do up to 10 people. And there is either for indoor or outdoor, but that's the number. So it's up to 10 people. And then the last zone is the yellow zone. In the yellow zone, all the schools are open. The only difference is that students need to be tested. And I know that the governor rolled out some information for that. But all businesses can open the same way that they are in the rest of the city. For food service, indoor and outdoor seating is both allowed. The only big difference between other parts of the city that are not in the yellow zones is that there's a 4-person maximum per table. So you can still have indoor, you can still have outdoor, you can still do takeout and delivery, but it's just that 4-person maximum per table for anyone who's eating at the establishment. Houses of worship, no change as the rest of the city, so 50% max capacity, that's what we have everywhere else. And for gatherings, non-essential gatherings are limited to 25 people, both for indoor and outdoor. The fees that happen with a lot of these different sectors and for individuals are no joke. There are inspectors from multiple city agencies as well as state agencies. So I've seen everyone from state troopers and Department of Health from the state level to DOT and TLC for Taxi and Limousine Commission and every, Department of Buildings, all of these different inspectors. And so everyone on the city level that's an inspector is going to be armed with information. They're going to be armed with additional masks to give away for people if they see someone's not wearing a mask, and they're going to be armed with a ticket book so that they will issue violations. If you've got a gathering that exceeds the amount that you're allowed to do, that's a $15,000 violation per day. So if you've got an event that you want to have a 3-day wedding with 500 people, you're going to be seeing, what is that? That's, math's not great, but it's 15,000 times 3. So you're going to see $45,000 in violation. Even if the wedding ultimately does not end up happening as big as you thought it was going to, that's still the case. Same thing for individuals who are not wearing masks. You can wear a mask, you can wear a face shield. I know Chris has often worn a face shield and others do too. The kind of face covering is not a specific kind. It's not that you have to wear, an N95 or you have to wear, something else. As long as you're covering your mouth and your nose, you're going to be fine. Otherwise, that's a $1,000 violation for that. So the city and the state are really not playing around with people. We're very, very concerned on the city level to make sure everything is contained. And so this is why we're doing this in the sense of like getting that information out. The main thing is that you want to be safe. If you want to know what your particular zone is, it's another very simple website. It's nyc.gov, but instead of /COVID test, it's just COVID zone. And so when you click on that, you put in your address. And when you put in your address, it will not only show you on the map, it'll actually tell you what zone you're in, and then it'll give you the restrictions for those zones. And I recommend that everybody look not just where they live, but also if they're planning to go somewhere. If they worship in a particular place, check out the address for your house of worship. If you are planning on going to some kind of gathering or would like to set up a gathering, please look to see if a gathering at all is allowed, and if so, what those limitations may be, or they won't be. So that's something extremely important. And so all of the locations, again, they may change on Thursday, so we're gonna have to wait for the governor to make his decision on that. But as of now, that's kind of where we're at. If anybody has any questions about what a specific zone means or anything else, please let me know. I'm here
Maria, before you go, you left out one very important piece.
Yes.
And that's why we're covering Manhattan. I'm just kidding. Just to remind everyone, Maria Mark will be joining with me with the 3 other advisory councils. As I said before, as Deborah and Joyce said, Joyce has to run an emergency, but as helping the stop of the Corona-19 spread, Brooklyn, Bronx, and Queens Family Support Advisory Councils will be hosting a town hall next Monday. There will be 2 of them, daytime, 10:30 to 12:30, and 6 to 8. And that is the Ring Central. Please make sure that you go on the meetings, or it doesn't matter, ringcentral.com/join. Then make sure you write down the meeting ID number. You will get on, and Maria will have special guest stars, which we're not saying, but we definitely know one of them is her, so she will be there. So please make sure that you are getting this, and I will remind you later again. Now, Maria, we do have a person who has a question. It's Laurie Rosenfeld.
Hi, good morning.
Good morning.
I'm the second vice chair of the council. I just want to know.
First vice chair.
Yeah, first vice chair, yes, I'm sorry. Coffee hasn't set in yet, so excuse me. For Maria, can you repeat the website for the zone, the COVID zone?
Yeah.
Or can you post it?
Yes, she's posting it.
Yes.
It's nyc.gov/COVID zone for anybody on the phone. That way, because they might not be able to see the screen, but they try to keep it very, very simple for both of these. Yeah.
Maria, I
Yes,
think it was
thank you.
And I actually will back up, Laurie. Can you put something under the chat, please? That piece, because everyone knows, you can see her phone number and her email.
But that's one thing we didn't add in because we just found out today.
Yeah, I'll put that in right now.
Yeah,
Thank you, Maria. And but wait, Maria, Maria, with what kind, when they do the testing, what type of testing do they do at the test site?
So they are doing the nasal one. From what I hear, the results come in fairly quickly. And so that's definitely one of them. Hang on, COVID zone. I believe for the students, because I know that when they're doing anything in schools, the students that are getting tested have the smaller swabs, so they're more kid-friendly, you know, as much as it is. I mean, I don't know how many people have gotten tested how many times, but but they do have the smaller ones for the students, because they do tests in schools. Yeah.
Maria, if say a person knows they have like a issue with their sinuses, what's the alternative testing?
I think that's what they have in the mobile sites are maybe different, but I don't know if they have anything in some of the other sites. So there's things like the H&H sites, which is health and hospitals.
Yes.
So they're like the clinics, they may have additional things, but for the testing that is like the mobile units that they've deployed all over the red and orange zones specifically, I believe also in some possibly some yellow zones, but I know definitely in the red zones and in the orange zones, those tests are just the nasal ones. And that's because they're trying to get as many people in and out as possible. They want to make sure that people, and all these tests are free. No insurance is necessary. No ID is necessary. So if you don't have ID or you don't have insurance, you don't have to worry. Or if you know a family that is too scared to go and get tested because they're concerned because they, don't have ID or something, please, everybody can go in. I went to a mobile site not that long ago. I just had to write my information. I didn't have to give them anything. That's it. Yeah.
And Maria, I'm going to vouch with you on one thing. I already been tested already, and I'm going to say how many times? 20.
Wow.
And
They used him as a test subject. What can I tell you?
Yeah, in the beginning, yes, they did, and I did tell Maria this, and I did say this that when we had her at the last meeting, I said they tested me and they said, "Chris, you're too healthy. Get away from me." That was my medical doctor, but that's a joke. Just to give the bit of confidence. But I'll be honest with you, I can vouch with every HAZ house and hospital. They have tested it. They actually work with our disability, because I had another person that was a little nervous. I made sure. So guys, if you don't want to do these testing sites, I will say you have a choice: A, there, B, go see a doctor, or C, go see HAZ Health and Hospital. And I can tell you that they do really well. If you don't have insurance and you bring up your bills and this, you will be covered for 1 year. I can vouch that because we have one person did get that. And I have to say it's gotten much better, and we need to continue advocating for all our hospitals as well. Does anyone else have a question for Maria Mark? The young and beautiful Maria Mark. And I'm daring anyone because I see everyone's quiet. The only person.
Me, Laurie?
Oh, go ahead, Laurie. You have another question?
Hi. Okay. For Maria again, I'm sorry.
That's okay.
A lot of places are taking temperature before you're allowed to go in. Is that a condition that, I mean, I know it's great that they're doing that, but I mean, does that mean that if your temperature is normal, that you don't have COVID? I'm a little confused at that.
So it does not mean that. There are certain establishments that are required 100% to test. If you
1 second, Maria, I'm sorry, somebody's shouting. Laurie, who's shouting?
Say again?
Who's shouting? I just heard someone said, "Hey, can we please have one meeting? I want to make sure you guys hear Maria, please." Go ahead, Maria. I'm sorry. Just got to
okay. So there are certain establishments that are required by by the rules and by the law that they have to do temperature checks. It does not mean that you are negative. What it does mean is that like if you have a fever, you can't go in. It's a lot clearer, especially because sometimes people are asymptomatic and sometimes they're symptomatic. When they're symptomatic and they're coughing and they're sneezing all over you, you know, that's a big concern. It doesn't necessarily mean that you don't have it. It's just that if you do have a fever, there's a there might be a chance. And even if you don't have COVID, if you've got a fever and you're sick, you shouldn't be going outside. Some people may not realize right away that they've got a fever, but that's kind of why they do it. When you go to indoor dining, you have to have your temperature checked. You cannot do indoor dining without that. There are definitely a number of different things. Child care providers, they have to test they have to do temperature checks. There's so many different kind of offices that have to do it. And if that is the case, you know, you should just go through it. But again, it doesn't mean that you're not, it doesn't mean you don't have COVID. It just means that there is a better chance that you might not. And if you do have a high temperature, even if it's not COVID, you don't want to be in a situation where you're getting other people sick. So that's why they have that as one of the requirements.
And temperature also, just so everyone know, at restaurants, and I could vouch for Maria because
yeah, they did it to us.
They did it to us, and I actually didn't complain because, first of all, yes, they take the temperature, and actually this is at one of the buffets in Sheepshead Bay did, the Flame. They ask you they take your temperature, they ask you for your phone number, which I don't care because if something does go wrong, let's say Marie went there, she wants to check the book, let's say there was suspicions on the temperature, she can, you know, call us and check if we are okay. You know, it's supposed to make sure that we are protected and we have to stay healthy. And this is something we all need to do. So, and I do want to thank Maria because that's why we always say commissioner, but we like to call her commissioner, but sooner or later we're gonna have to call her superhero next.
No, Superwoman.
Yeah, Superwoman.
But, yeah.
Yes, because oh no, we can call her the next new Wonder Woman. All the world is waiting for you. But let me ask if anyone has any questions. Last call, because we do want to move on to other. We have to make sure that our subcommittee reports are coming in as well as other reports.
If anybody has it, raise your hand.
Say your piece, because I'm looking. Going once, going twice. Okay, Maria, I want to thank you so much.
Thank you.
And also, I left a little present on top. For your safety, staff plus visits must wear masks at all times. So that was brought to you by HAC.
Wonderful. Thank you.
And Maria, we'll see you next week.
Yes, you will.
I get the double dose.
No, I get triple because you'll be at my community court. I'm the one who's lucky.
Okay.
Thanks, Maria.
Okay.
We do appreciate all you've done.
Now, as fortunately,
thank you.
You're welcome.
Unfortunately, now you got me laughing all day now. Unfortunately, Joyce had to leave as you know, everything is gone, you know, things have to get back to business. I'm gonna move on to our subcommittee reports. So I am gonna start with Children's Committee. Is there available? Is Teresa here? Because I know I saw her name here somewhere.
Teresa, are you here? Okay, she probably had an emergency.
Or maybe you didn't realize, but it's okay. So we're gonna move on. Then I'm just gonna do this quickly. The next, okay, as I have spoken to with Joyce's know this already. The next Children's Committee meeting is November 10th. Okay, someone just popped.
Is that you, Teresa?
Someone just popped. I just heard a noise. Nope. So,
well.
All right, let me just move on. As I said before, the next Children's Committee meeting is November 10th. The topic is planning for the future. Yes, we'll be on Ring Central. Please make sure you always put in ringcentral.com/joint and make sure you write down the meeting ID number. It's like a telephone, but computer way.
And we will resend the information out.
And it's also available on the website. So please make sure. So, and as I said, it's always good to see every parent, agencies, young, because remember, we got to make sure our young children are staying healthy and safe.
And
as
we
well.
need to make sure that since children are provisional from birth until age 8, we need to make sure that children who have showing signs of developmental disabilities are given the help they need so their families, they can go forward. All right, and the next, so that's that, okay.
Okay, now the next committee, and I hope she's here, I'm going to say, care coordination. Rose, are you here? Either way, you can say it. Go ahead.
Okay, hello, as Deborah, I'm the co-chair for this committee, and we will have the meeting this Wednesday, October 21st, from 9, the meeting will start at 9, but we'll be starting officially at 10 a.m. This is very important. Agencies, please tell your care coordinators and come on. Also, PHP and families, parents, professional, everyone's welcome because we need to discuss what is going on, how we can work and help each other because of this COVID-19. So, and any cutbacks that have been affected, because we want to know what the care coordinators have been able to do out in the field for our families. So it's this Wednesday, October 21st, and you can get on starting 9:30, but the meeting starts at 10 a.m. As usual, we're doing it on Ring Central. So the information will be, it's in the chat, it's on right now if you can see it. It's also on the Brooklyn Family Support Service Advisory Council's website. And we do help the DD Council by having any subcommittees listed on our website. So that's for that committee.
Now, is Mary Christopher here, or what's her name? I got her co-chair. I mean,
the co-chair.
The co-chair is one of them here.
Tanya.
Tanya or Mary?
Oh, Mary, are you there?
Let's see. Seems everyone. Let's see. I don't see neither of them.
All right, so Christopher
just
and I will do it together.
I'll just finish this part here because then we can move on. Our next the next transition meeting is Thursday, November. Wait a minute, Carrie, you're here.
Carrie Banks.
I know Carrie's here because she's also chairs this committee.
Hi. Yeah,
Hi.
I'm here and I had my hand raised.
Yes, you did.
I see you.
Carrie, we're going to let you discuss this time because even though we all 3 of us were there, please help. Thank you.
Okay. We met last week on Thursday. It was our first meeting. It was really nice to see everybody, and we discussed some serious issues, like the fact that a lot of the 2019 graduates, of course, still don't have placements because of things being virtual, because of the process being difficult to have done virtually. So Department of Education has mandated that those graduates be followed up with by the transition coordinators until they do get services. So that's something that the transition coordinators are doing this year. So they have last year's graduates and this year's graduates. The other thing that came out is that a lot of the coordinators have higher than usual number of graduates. There are a lot of graduates coming this year. So that's going to put extra stress on the transition coordinators, many of whom are also teaching this year because of the shortage of teachers. So there is a lot of stress in the system. One thing that people did say was that the CCOs have been better about responding and getting back to parents and to the transition coordinators and to the individuals. So that was really nice to hear.
We did have from OPWDD, we do have a transition.
Yes.
Our linkage from Brooklyn DDRO, I just apologize, her name just blanked on me.
Me too, Deborah. But maybe we can put that in the minutes when one of us remembers.
Some ginkgo. We need to drink some ginkgo biloba or something.
Wait a minute, Lucy's
Lucy,
here.
are you there?
Yes. Did you say that you forgot her name? Elizabeth Joseph.
Thank
Elizabeth
you.
Joseph, thank you.
Thank you,
You're welcome.
Lucy. We blanked. I apologize.
And I have to,
That's okay.
Yeah.
Mhm.
and I'll add a question after this part. I'll add to help because we're getting tired this morning.
Yeah, we are.
Sorry.
And Carrie can double team with me. The next meeting on this meeting is November 19th, 2020 at 10 a.m. It will be live on the Zoom. Compliments from the young and beautiful Carrie Banks, which
Thank you for your assistance,
Carrie. You see-
Carrie, I apologize. I need more coffee.
That's all right. Just to clarify,
Yeah.
Chris, I am no longer young, and I have earned every gray hair. So
I have gray hairs, but I like to dye them.
yeah. So I'm just saying, not necessary.
But no, Carrie.
It's a Brooklyn charm.
Carrie, you know something? I had started getting gray hairs at age 25.
Yeah, so did I.
And Carrie will let us. Mary will, as well as that committee will be letting everyone know when they send the Zoom ID number. So everyone who has any questions can contact Mary Christopher at this information you see here. Now, that is on November 19th, so they will be reminding everyone the meeting is the next day because our meeting will be on the 18th, the joint meeting. So
Thank you,
Carrie,
Christopher.
yes, and Carrie, I want to thank you on because Joyce had to leave, but she did say thank you on behalf of the DD Council. Working with the transition committee, linking them up to Zoom.
We appreciate
I'm happy to help.
Yes, because that's the one thing that we always got to remind everyone: work as a team. Teamwork is the strongest word. We have to keep that up. We are Brooklyn. We're strong, as the governor says, and we're lovable. But but we have to keep the force with us. So I want to thank Carrie. And Carrie, don't worry. I know you have announcements. We'll be doing that after I do the outreach report. It's something. I have a present for everyone.
Thank you, Chris.
You're gonna love my presence.
welcome, Aunt
You're gonna
Carrie.
love my presence. Even Carrie's gonna die to know.
All right. Thanks, Chris.
No problem. Let me move on to the best part of the best part. Now, advisory councils, outreach update. As you know, we had the last one was don't remind me dates right now. I'm just gonna say we did have a really good turnout. As you know, we had different agencies came in, and gave a lot of good information. We did get a lot of people asking me this question, which I'm going to say you're not going to find that out until November. So I'll move on. Remind everyone, and as Maria Marks said already, you should be making sure everyone should be wearing a face mask at all times.
But wear it correctly. That means your face, your nose, and mouth have to be covered.
Yes. And as well as, and I know someone's been writing a lot, but that's good. So please make sure. And I'm going to remind everyone, even when you're on the subway or the bus, wear a mask. Its sign is of respect. And remind everyone, face masks, if you don't have one, or say, God forbid, one gets damaged, you can get it at the ticket booth. And you can grab one. Hand sanitizers are always available at any station. If you see that a hand sanitizer station is empty, you can always put it onto My MT app and put it into a complaint. You can say it's a complaint saying it's empty. And then some cleaner will have to come there and make sure it's filled up. They were supposed to be doing that at all stations every day to make sure. And it's not a problem to make sure you have some in your hand as well. So please make sure you have that. Now, I'll remind this again, I'm going to say this again each time. As 3 of the boroughs, which are doing the Brooklyn, Bronx, and Queens next Monday, I hope to see every family, agency, every nook and cranny to join us. As Maria will be joining us with special guest stars, we are going to be making sure that the coronavirus 19 is not going to spread. And we want to make sure everyone has a face mask or know how to do a coronavirus testing. You have questions during this Corona-19, bring them. And I'm going to remind you, bring the questions there. You have a choice of the daytime, 10:30 to 12:30, and nighttime, 6 p.m. to 8 p.m. Please, guys, read it very carefully as I repeat. ringcentral.com/joint. Once you see that thing clicks up, and it's going to ask you for meeting ID number. Think of this as your phone number. This is a phone number. Make sure you have this. as well as if you're doing by phone only, please make sure you have this, as well as the meeting ID number. But when you're doing this on the phone, make sure you press pound, and then you're on. And I'll say this, it's going to be a very interesting, and I will tell you, it's just going to be making sure we all wear a mask or a face shield. So please make sure. Coronavirus is very important. We want to make sure, and especially voting, as I'm going to strongly remind you. Debbie has mentioned this already. Also, so many times, as well as Joyce, we have a new person, which she was also at the last outreach update. Her name is Ariel. Yes, like the Little Mermaid, ADA coordinator. And I have to tell you,
Ariel Merkel.
I can tell you, half of us were there. Was very fascinating. And I know Carrie can vouch with me on that one. She is, the ADA coordinator. This is her phone number, her email. Please make sure you have this if any issues or goes on. Now, if you guys are getting your ballot and you don't feel comfortable mailing it, as Deborah mentioned, yes, bring it to a post office. Let's say if, an agency, you have a group home, or doesn't matter, you have all those absentee ballots, bring it to the polling site and make sure you see the coordinator. I will say that because some of the people who are inspectors don't have the light bulb, but the coordinator does have to follow all instructions from here. And I remind you, if you're going to do the early voting, make sure that you follow these hours in all 5 boroughs, wherever your site is. If you need to find out what the site is, please make sure you go on to findyourvoting.nyc. And let's remind you, this is just copy and pasting on. This is a very important election, especially next year. It's going to be very important for city as well. This year is city, and I did check. It is partial city, which is 1, maybe might not, state, federal election. Please, please, guys. And very important, there is face masks always available. Face shields, you can always make sure you get one anywhere, but always make sure that you can vote there in person, vote early, get an absentee ballot. But unfortunately, you can't get it now because the absentee ballots are expired. But if you got one in the mail already and you don't want to bring it, mail it, you can bring it to your polling site. And if you have any questions about that, you can ask me after I finish.
Okay, I have one more very important announcement. I just want everybody to know that my counterpart in the Bronx, Tina Bale, the chair, has put her information at the bottom in the chat. So if you need to contact her because you're in the Bronx, please contact Tina Bale.
Yes, and I was going to thank you, Tina. I think I know she's somewhere. That's maybe not. Just to remind everyone, you may got this in the email. The New York City Transit System-wide accessibility, this is the link. You can actually go on to the MyMTA website and click on accessibility. It has some new stuff, especially the new updated larger map is available on the website if you do have a computer. Just to note that on the screens, they're available at the train stations. You can always don't know if the new maps are at the ticket booth. Sometimes they run out. You can always ask them at the station as well. But regarding newsletters, you can always get one if you go into the MTA or just click on New York City Transit System-wide Accessibility newsletter with that I just got it from. I just copy and pasted. All right, and as you see a sample here, this is what they've been doing. This is part of the new map. And you can always, once you get on that newsletter, this is what they're doing. And to remind everyone, if you have a complaint on the transit system, you can always email accessibility@nyc.com. And one of the staff from there will respond to you as soon as possible. Advisory to the transit, and it's called ACTA, which you know I am a member of. We will be keeping everyone up to date on the new card called the Omni card. So we'll keep you updated. Now, remind everyone, our next outreach update is not until December 2nd. Speaker is to be announced. I will remind everyone at the next meeting in November who will be. That's only I'm going to say from that point. I know I see a lot of flashing going on, and I'm going to ask, does anyone have any questions? And I remind everyone, please raise your hand, or you having a problem with it, please let me know right now. Okay. Now, at this time, I'm going to start with, now the next step is announcements. Does anyone, I know Carrie has an announcement somewhere.
Where are you, Carrie? We want to hear your announcement. Plus,
I'm
Carrie,
right here.
and please let everyone know what's the updates with the Brooklyn Public Library. Thank
Okay.
you.
Well, the updates are, of course, that we are continuing to provide virtual services throughout Brooklyn. And you can access those at our website, www.bklynlibrary.org. We had opened service at, I think, 12 of our branches, and what we're calling step 3, which is lobby service. So you could go to the buildings, go to the lobby, pick up your books, check them out, return books. However, we've had to close several of the branches that we had opened because of spikes in coronavirus testing rates in the neighborhoods. So what I suggest, because it really is changing day to day, I got a new list today of a couple of new ones that are closed. What I suggest is when you want to go to the library that you check our website first to see that the branch that you want to go to is open, and do know that there'll be limited service on site. Or you can call our central library, and I'll put those links in the chat when I'm done. We do have some great programming going on throughout the system while we're closed, so look on our calendar of events for that. At Inclusive Services in particular, of course, we have some super great events going on, including tomorrow. Ruth DeRoma from Include NYC is doing a workshop on essentially dealing with virtual learning. So it's dealing with the Department of Education and navigating that system and getting the services that the kids need, that the students need, including transition services and others, occupational therapy, physical therapy, those kinds of things. At the same time, we know that families are struggling just with the learning at home, right, with their kids. And then, so she'll be talking about ways to help your students manage their days, how to help keep them focused, looking at how their disabilities impact their ability to learn virtually and ways to get around that, and keeping them engaged and helping sort of manage the stress overall in the family. So that's tomorrow from 10 to 12. If there's more information on that at the very top of the chat. If you have questions about it, you can email me, and I will also put my email in the chat, and you can also register. We have a Music for Autism concert coming up this weekend. It's a really cool new group called Invoke, and they came together since the Black Lives Matter, movement, and they are dedicated to playing work by Black and people of color, composed by Black people and people of color. So check that out. You can check it out on our website, or again, email me directly for more information. And that is an autism-friendly concert. And we've got some other things, some gardening and stuff, but it's all early in the chat. So check it out and come and visit us at Brooklyn Public Library online. Thank you.
Thank you, Carrie.
Thank you, Carrie.
Appreciate it.
Now we have 2 people raise their hand. Now I'm gonna, I know Sandy had her hand up. We have someone else, Sandy, before you. No. 917-524-4856.
And who is this?
Yes. I'm Juliette Hawkins from New York State Institute on Disability. And I wanted to make... Hello?
Hello?
We hear you.
We can hear you.
Okay, great. So I just wanted to make some announcements about openings that we have. Number one, a program that I run, crisis intervention, and this is really important because people are under a lot of stress.
Yes. Mm-hmm.
Our parents are, kids are, and we have openings in our crisis intervention program. My number is 917-524-4856, and for Brooklyn families, and it's a family support contract, so even if they're not, as long as they have eligibility, even if they don't have the waiver, they can still receive services from us. The other thing is that we have evaluations for people who do not have Medicaid and are looking to get qualified for OPWDD services. Elizabeth Sunshine is in charge of that. Her number is 917-699-0578. And last, we have openings for reimbursement. We really are welcoming applications. The person in charge of that is Jackie Tripodi, Tripodi. Her number is 718-494-6457. And that's it for me.
And just to let you know, Dolores is with you also.
Right.
That's what,
Juliet's my colleague, and I have nothing to add, except we also have tickets. We have tickets available for entertainment and recreation, and I put the information in the chat, and people who are interested can email us, and we'd send them an application.
Although I don't know how that's working, right? Because of COVID, so that's interesting.
No, the numbers and the email are directly, everybody's working remotely, and the numbers are direct cell phone numbers of the individuals who've taken care of each service, and they send the applications out.
I thank you both ladies very much.
Thank you.
And let me get Sandy.
Hi, everyone. How are you doing?
Good. Fine.
Good. This is Sandy from the Deaf Community Network. And I just want to let you know that our Family Connect Summit is going on right now. But you can still register and get access to the videos until October 25th. I put the link on the chat. So still register, because you can still see the videos. You'll be able to see them all week. Regarding our other services, such as ComHab, Respite, Family Reimbursement, and other services, please call our Project Connect line. It's 877-827. Or you can email Project Connect at adaptcommunitynetwork.org. Thank you very much.
Thank you, Sandy.
And I know we have someone else just raised their hand. It is from Tang.
Matthew?
No. Go ahead. You're off mute. Oh, looks like he disconnected himself. No, it's Tang. There he is. Tang, you could go ahead. You.
Hello?
Tang, you're not on mute. You can speak.
Oh, hello. Are you able to hear me?
Yes.
Okay. Thank you. Sorry about that. Hello, everyone. This is Joe from GHO, Outreach Coordinator from GHO. Just want to let everyone know that we are continue have contract with Care Design and helping Chinese and Korean speaking families to get OPWDD eligibility or CDMY enrollment to process. And also, we have openings in our waiver programs, including Community Hub, They Have Without Walls, Support Employment, and other waiver programs. If there's anyone interested in any of the waiver programs or have any question or concern, feel free to contact me at 718-663-6523 or contact my supervisor, Pat, at 347-828-6660. Thank you.
Thank you. Since no one else has, okay, 1 second. Dolores, you have a question?
No.
Oh, because I told you come close. I was like, oh.
Someone's name.
Oh.
Because the names I wanted to see.
Yeah,
person.
His name is Tang, T-A-N.
Right.
T-A-N. Tan, I said it. All right, and I know that GHO is ready to speak because she's already coming off.
Yeah, hi.
Go ahead.
Hi everyone, this is Daisho Choi Park, a Korean outreach coordinator from GHO. Joe mentioned everything covered. Just I want to emphasize, we have a family support services for Brooklyn families as well. I'm full-time Korean speaking staff, so I can assist the family fully. And also a waiver program. If you have any questions, they can call me at 718-307-6570. I also do the Care Design New York Korean intake. I posted my information in the chat room. Thank you. It was
We appreciate it.
great
Thank you very much.
Okay, thank you.
Okay, anybody else has raised their hands? Ask a question, have more information.
Anyone else has any announcements or wants to bring up something? Say your piece, say your soul.
And we do hope that we will see a lot of you on Wednesday, the care coordination meeting. It's very important.
And so now, does anyone else have any other announcements? I'm going to recheck one last time on the thing, and I know I just heard a boop. That wasn't me. Okay, since no one else has any other announcements, then I'll just remind everyone before we adjourn that I'm going to remind everyone that please make sure that you pass the word. As you know, Bronx was on, I didn't know today, but it's all good. Please make sure that you can contact Brooklyn, Bronx, and Queens. You can always try to reach one of them. But I remind you, this is the town hall that's coming up next Monday. As I said before, Brooklyn, Bronx, and Queens Advisory Council will be hosting a town hall. One will be at 10:30 to 12:30 and 6 p.m. to 8 p.m. Remind everyone, you can go on Ring Central. Now, someone's flashing, so I don't know who that is. Hello, everyone. Thank you. Oh, Matthew, you want to say something? Because now all of a sudden, I see your face there.
Hello, Matthew.
Matthew.
Hello, everyone. I just wanted to say, please stay safe. And I made my announcements via the chat, so.
You can say it now.
Yep, you can say some of it.
Just give Link a call for any questions you have, 212-273-6182. Please call us or email us.
And Matthew, please call me later.
I will, Chris.
Thank you. Now, this is all. I'm glad Matthew's on this because I'm going to remind him as well. Double header. Please pass the word out. And let me remind everyone, this is the information. Please make sure. As you know, Mayor of Community Affairs Maria Mark was on. She will be joining with us with special guest stars, and we will you will see, and you will be enjoying yourself. And try to make sure help your fellow families, brothers, sisters, mothers, uncles, cousins, anything. Let's try to keep the peace. Let's keep New York strong. Now, remind everyone, our next joint meeting is November 18th, which I'm going to realize, yes, it's Wednesday, because I'm thinking
wait a minute, look at the calendar.
Yes, it is Wednesday. Because you know what it is. Everyone's telling me, no, it's Monday, it's Wednesday. Well, it's Wednesday. So I was right the first time, years ago, a month ago.
Yeah, it's Wednesday, sorry.
Yeah, Wednesday. So please make sure that you are November 18th. The topic is to be announced, and it will be on the same system, Ring Central, and same code. So as a reminder, please keep the code.
And we will update to have it say Wednesday.
Yes. And to remind everyone again, please make sure it's voting season.
Vote.
Vote. I don't want to hear any excuses. I don't want to hear anything. Go out and vote whoever you want to vote for. Just make sure the disability vote is in there. That's the main thing. So.
And use the ballot marking device known as a BMD. Very important.
Yes. So since no one else has anything else, I'd like to thank everyone. Thank you for coming to today's meeting. Hope to see everyone there on Wednesday at the care coordination meeting. So we can make sure you pass the word to your care coordination people that I want to see them, as well as parents who are still on. Please come as well.
Parents are invited.
Everyone is welcome.
We're all important. We're all equal in this.
Yes. So we hope to see you guys at the next meeting. Please enjoy your day. Thank you, everyone. And meeting is now ended.
It's adjourned. Thank you.
Thank you, everyone.
Stay well.
Thank you.
Thank you, everyone. Stay well. Thank you.
Bye.
Thank you.
Bye.